I feel a bit intimidated. I don't know what I can teach you at all about leadership. So what I'm going to do is give you three stories, three case studies of three real nurses that I've come across in the UK that I think have developed real leadership style skills. And while I'm talking about these three stories, I would invite you to write down, if you don't mind, the skills and the leadership styles that you can pick up from these three very different nurses. All of them started working in general practice. And the first nurse is a nurse called Rachel. And Rachel worked in a little rural practice in Bedfordshire. It was a practice that was very much a farming area. And we had, in that particular practice, very high levels of men who were suffering from depression, the isolation of being farm workers and the difficulty in farming in our country that was going on. So Rachel, when she'd only worked there for about 6 months, decided that when she looked at the GP data, that they weren't seeing a lot of men coming in. It was obviously women and families that were coming in, which is usual here, I understand. So what she thought she'd do was try and go out and meet the men and see if she could help them improve their healthcare. So Rachel started completely in her own time. She had her GPs, not surprisingly, were not really supportive of what she was going to do, but they didn't stop her either. And what Rachel did was go into the local pubs, first of all, and sit there in the evening in her nurse's uniform. Don't get the wrong idea about Rachel at all. And she'd have a blood pressure machine with her, and what she did was chat to the people in there, take their blood pressure, talk them about stop smoking, safe drinking, and all those sort of things. And that went very well, but after a while she thought she's not getting to the masses. And so what she did was hire a village hall, the village hall in the village where she worked, and decided she was going to run an evening on men's health. And people said to her, but you won't get men to come to it. Now, but is not in Rachel's vocabulary. She didn't use the word but. She used the word and. So she said, and we don't get men into the surgery to discuss their health. So how can we address that? So that gave a whole inference into the way her mind worked. So she hired the village hall for this evening. She also talked to specialists, consultants, nurses, doctors, etc. in areas of alcohol, safe drinking levels, stop smoking. She rallied a consultant doctor to come and give a talk on testicular examination, prostate cancer. So she was going to have a whole evening of discussing different areas of health for men. And then she went round to the clubs where she thought men would be, like the local fishing club that had a lot of members in the area. And I saw the flyer that she put up in that particular club, and it said, come and learn more about examining your tackle. And she stuck posters everywhere. And you know, that night I was there were 120 men turned up for that evening. It was hugely successful. She'd corralled her nurse colleagues, and we were sat round the room with blood pressure machines, all sorts of gadgets, spirometry, etc. So during the breaks, and the local women's group provided tea and coffee, we talked to the men as well. And over a period of a year or more, because of the data that she kept in general practice, or the GPs did as well, the prescribing rates for antidepressant drugs went down. More men were attending stop smoking clinics, etc., etc. So it was very successful. And also her GPs, because of the success, started to be more actively supportive of Rachel. Rachel was doing this all in her own time. From there, she developed other evenings on women's health, children's health, all sorts of avenues in this village hall. And apart from the time, it cost her nothing. Everybody was very willing to give of their time. So that was Rachel. She always dressed in her uniform. She was always very quietly confident about what she was doing. Failure wasn't in her vocabulary. And she had a very good personal contact with people, that they were very happy to give of their time, these expert specialists, to help what Rachel was doing. What Rachel is doing now, she advises the Department of Health on different ways of improving healthcare. Not the normal, the mindset that we have, maybe, I have in general practice of doing things. It's really thinking outside of the box and working with other people to make things happen. So that's Rachel. The next person I want to talk about is Greta. And this Greta was a practice nurse back in the 1980s in a practice in Stratford-upon-Avon. And what Greta did, I must, of course, thank Stewart very much for lending me this slide. It's amazing what some people do in their spare time, isn't it? And what Greta did, she worked in a general practice in Stratford-upon-Avon. And we had no nurse-led healthcare at that time, no clinics. And Greta's GP realised that you had a lot of patients being referred for asthma exacerbations to outpatients clinic, A&E, nebulisations in the surgery. They weren't practising preventative care, they were just dealing with acute care. So he educated and trained Greta to look at providing preventative care for patients with asthma. And over a period of 6 months or a year, what they started to see was the levels of patients who needed acute care significantly went down, and also the costs for that care went down in the surgery. Preventative drug care went up, but the patients were much better, didn't have time off work and school, etc. Now, the vision Greta had was, well, if I can do this, other nurses can do this as well. So what Greta started was training for practice nurses in the area of asthma preventative care. And she wrote a manual, and her GP colleague helped her do this as well, on the management of asthma for nurses. And she talked to a local pharmaceutical company who put forward the money to rent a very small premises where she could hold the training courses. And the very first course consisted of about 8 nurses, that was all. But it grew, and it grew. And as it grew, she realised she couldn't manage this teaching on her own. So from the very brightest of the nurses she trained, she also trained them to become trainers. And these nurses had come from all over the UK. So they started, this is over a period of years, to develop the training courses out in different areas. She also obviously needed administrators and management staff to help her run this. She hadn't got those sort of skills. She had vision, she had ideas, but what she was able to do was to talk very articulately to people who would support her in doing this. She was also very skilled in picking the best people. She picked the best nurses to become the best trainers. She picked the best people to become the managers of the business that she created and the secretarial staff, etc., etc. She also was able to, she was very articulate, very intelligent, very charismatic. So everyone was very, very keen to be part of this amazing story that she was developing. She was able to talk to any of us nurses. She was able to advise government and to work at a very high level as well. And if she walked in the door now, you'd recognise her. The main colour she would be dressed in his red, I think. Very smart, so very different to Rachel, who always wore her uniform and was equally successful in a very different way and different manner. And they both started out as practice nurses. So that's just a little snippet of Greta's story. The last example I want to give is somebody called Barbara. And Barbara was a nurse practitioner. She worked in general practice in Birmingham, and she'd been trained as a nurse practitioner in America and come back to the UK. There wasn't any nurse practitioners in the UK at that time. Again, this was the mid-80s, 1980s. And what Barbara saw, that this was a real opportunity to develop nursing in general practice. The GPs was an ageing workforce. Practice nurses were bursting at the seams with the work they had to do. So she saw this as another level that would be really helpful in primary care, in general practice in particular. So what she could have done was set up a course in much the same way as Greta did on her own and develop it that way. But Barbara thought in a different way. She wanted it to be an accredited university-based program. And what she wanted to do was not alienate people. She could have alienated GPs by doing this. She could have alienated other nursing bodies. She could have alienated the Department of Health. So what she did, she talked to these organisations over a period of about a year or more about the nurse practitioner role and really got them on her side. So she got them round the table, representatives from these organisations, to help her develop this concept of the nurse practitioner role. So they were all part of the steering group that developed the nurse practitioner role. And universities were involved as well. So eventually the Royal College of Nursing in the UK took on the mantle of running the first nurse practitioner course in the UK, and the first course of students qualified, the first 15 students qualified in 1991. And from there, other universities have developed this nurse practitioner program in the UK. In those days, it was a diploma level program. Now it's a master's level program. But Barbara's approach was very different to Greta's, equally successful, and very different to Rachel's, but equally successful. And they all had leadership skills. Some of the leadership skills are the same, and I think some of them are different. One of the skills that I think they all definitely have is the art of communication, but maybe in different ways. So that was Barbara. I want to just mention, as I'm talking, I'm thinking if I can tell you a little story about a member of my family. She wasn't a leader, but actually she had vision. But the vision wasn't obvious until after she died. When my sister and I were children, my father used to insist that we go and see his sister, my aunt. She never married. Every Saturday morning we had to dress in our best dresses and were taken to see my aunt. And she would sit in a corner of the room. She always seemed to be, in my memory, dressed in black. And she would quiz us on what we'd done at school that week. And if we hadn't done very well, if we'd have failed any tests, we really got into trouble. Anyway, years passed, and eventually my elderly aunt died. And I went to her funeral. And I was sat next to a cousin of mine. And when the coffin was brought in, what was really odd to me, all the coffin bearers were women. And I've never seen that before. Is that the coffin bearers are always men in the UK. And I turned to my cousin and I whispered, "Isn't that strange? All the coffin bearers are women." And he said, "Sue, didn't you see your aunt's will?" I said, "No." He said, "She said No man took me out while I was alive. They sure as hell aren't going to take me out now I'm dead. So there was a vision, in more ways than one. So I just want to end and think about leadership and what it means to you. Now this is something that I did a few months ago. That's not my best look. You can see it down there. Now I want you to think about, what would you attempt to do if you knew you wouldn't fail? What would you attempt to do if you knew you couldn't fail? Nelson Mandela said, "Vision without action is merely dreaming. Action without vision is passing the time of day. With vision and action, you can really change the world." Thank you very much.